They're going for emergency contraception.
It's a real emergency contraception.
So the first one is that emergency contraception is a pill.
Yes.
Do we think that's true or false?
There's definitely a pill,
True.
yes.
Yeah.
True.
Yeah.
Is it always a pill though?
What do you think?
Yeah, it's true.
Yeah, I think
Oh, no,
so.
like, no,
'Cause
do
if
you think
go-
there's another way?
If you go to the chemist, it's just it's one tablet, isn't it?
Okay, there's no other forms of emergency contraception. I don't know.
Do you know of any other forms of emergency contraception?
No.
Have you heard of any other forms? It's both true and false because there are two kinds of pill. We've got Levanel and Ella1, but there's also a third method of emergency contraception. Does anyone know what that is? No. I just passed this around. Does anyone recognise this? Anyone seen one before?
You stick it up your vagina.
I think
I've seen one that you put in
That's so weird.
like before you get into an emergency situation. I don't get how this works in an emergency situation.
Oh, you mean like a coil, like the regular?
yeah,
like you already have.
Is this what the coil
Like,
looks
what
like?
does this do in an
Yeah,
emergency situation?
some women would know that as the coil. That's the IUD. It is a method of emergency contraception as well, though. So that can
So
be
how does it work, though?
that can be used up to 5 days after unprotected sex.
And then you take it back out again.
No, you can leave it in.
Forever.
Not forever. So typically up to about 5 years.
Pretty squidgy.
Yeah, it's quite squidgy. It's so small.
Some women, when they think about the coil, think of something quite hard and metallic, and then it's hard to imagine how you would sort of fit that without it being quite painful. But when you feel how it sort of squashes in, it's easier to imagine how that would be fitted, do you think? And the great thing about this, because it's what we would call a long-acting reversible method of contraception, or a LARC, it can be left in then after you've used it for the unprotected sex. It can be left in and used as your more regular method of contraception. But this is a statement. Do we think it's true or false? So it says, I need to take emergency contraception within 24 hours of unprotected sex
False.
for it to be effective.
False.
Why do you think it's false?
Because I've tried it.
It's
It's very effective.
Yeah, isn't it that it gets less and less effective. So, like, the sooner you take it, the better. But yeah, it's like three days.
Like with the 11L, I guess is the one that I know the best. And that's like 72 hours, I think. So it's,
Okay, so
it's like 3
11L.
days. So that's.
It's effective up to 3 days.
So I don't know about the
Okay.
other ones that you've just.
Ella1, which is the second pill, which we mentioned, is effective up to 5 days. And the emergency IUD is obviously also can be used up to 5 days after unprotected sex. Emergency contraception causes an abortion. Is that true or false? What do we think?
False.
Yeah, false.
Depends. Yeah.
Yeah, because it's like stopping the pregnancy from starting, not
Yeah.
stopping it once it's already started.
If you use emergency contraception before you become pregnant, then it can prevent the pregnancy. So it's very clear in medical guidelines in law that emergency contraception preventing a pregnancy and what would be an early medical abortion, which would be taking the abortion pill, that is ending a pregnancy. Two very different things. Okay, here's another one. Using hormonal contraception can affect my fertility.
I've been told that you shouldn't take it more than like 3 times in a year or something, or 6
Yeah,
times in a
I've-
year.
3 times in a year, 6 times
Yeah.
in a year. Any other?
I've heard 3 times.
times.
I've heard 3 times in your life.
Like,
That's what
Yeah.
freaks me out the most about emergency contraception, is that it's going to throw your hormones out of whack and then mess stuff up long term somehow.
Oh.
Really?
Completely, utterly false. So do you think that after everything we've talked about, your impression of emergency contraception has changed, about how it works, what it is, what the different options are?
For me, the main thing is the fertility thing, because I thought that it would affect your fertility.
Yeah, me too, actually.
yeah.
Sort of got rid of my fears of that.
I'm also glad to know you can get it for up to 5 days afterwards, because I think that's something that most of us didn't know.